we are more worried about those infections which are chronic, like hepatitis B and hepatitis C, because these infections are usually transmitted very commonly and then the chronicity happens. What is meant by chronic is that they are actually with the patient for years to come and they damage liver from hepatitis to cirrhosis and hepatocellular carcinoma. As you can see on the screen, that almost 360 million patients are infected with chronic hepatitis B infection, and of these at least 6 lakh or so die annually as a result of hepatitis. Now if you look at the prevention part of it, the hepatitis B can be prevented by means of hepatitis B viral infection, and only 60 to 70% of the patients are people are protected. So there is a huge need for hepatitis B prevention, and very effective vaccines are available which gives you protection more and above and more than 95%. So I think since the India is actually an endemic area with prevalence between 2 to 7%, and in Hyderabad with the recent study it was shown that up to 5% is the prevalence of hepatitis B. Now if you look at the hepatitis B, it's actually a DNA virus which is complex 42 nanometer complex size, and it's called as Dane particle also because that's antigen, and it has a high affinity for the liver and hepatocytes. That is where it damages the liver, and human being the prime reservoir, it transmits the infection from one person to other person. As far as the resistance of virus is concerned, it is actually killed by autoclaving for 30 to 60 minutes, and it can be destroyed by sodium hypochlorite, and we routinely use in hospitals whenever there is a spillover of blood, and that is what is recommended. As far as communicability is concerned, once the person is infected with hepatitis B, the person can transmit the infection for years to come. So once they are out of the incubation phase or during incubation phase, when they acquire the infection, from there onwards they can definitely transmit the infection, and it depends on the many factors. One of the factor is age. Most of the times we say that younger the age of onset of the hepatitis B, higher the chances of you getting a chronicity. So more important that we protect the people from the young age only itself. So if you look at the rate of transmission of hepatitis B who acquire at the first 5 years of age is almost 60 to 70%. And if those patients who are getting hepatitis B after 5 years of age, the rate of transmission only 25%. So definitely there is a high risk of transmission for younger age acquisition of hepatitis B. And who are those all risk factors? What are those risk factors we know? All those who are healthcare workers, high risk sexual behavior people, commercial sex workers, injectable drug abusers, frequent blood transfusion recipient like thalassemia or some various causes of different anemia patients, immunocompromised individuals like chronic liver disease for other etiologies or renal failure patient, HIV, and infant with HBV carrier. So these all are at risk of it, and the risk of transmission, the mode of transmission is exactly same for HIV and HBsAg. So it is through blood and blood products, serum exudates, saliva, seminal and vaginal fluids, then from mother to child. Then sometimes we also seen rare route of transmission through the shared needles, razors, toothpaste and all those things. So definitely it is very important for us to make sure that the routes of transmissions are protected and taken care of by safe sexual practices, behavioral changes and vaccination. Now as far as the incubation period is concerned, it's from 1 to 6 months and average is 75 days, and it can be detected as early as the 1 month from the time of onset of infection. Most of the acute infection patients, they present with vomiting, malaise and anorexia. That's a common symptom of any hepatitis, whether it's hepatitis B or C. And for our surprise, most of the patients who have acute hepatitis B, they are anicteric. So only suppose patient has got acute hepatitis B, there are only 20% to 25% of the patient who will have jaundice on clinical examination. Most of the patient will not have jaundice. They will have just anorexia, loss of appetite, vomiting and all these symptoms. So 75% of the acute hepatitis people go unnoticed because they don't have symptoms, which makes them yellow urine or yellow colored eyes. That's the biggest problem in detecting the hepatitis B, and then ultimately 1% of these acute hepatitis B may land up in fulminant hepatic failure and liver cell failure. So what we do, we try to prevent and control. Who are those people who needs care? Those patients who have a chronic liver disease for some other etiologies, they can also be protected. We can protect hepatitis B by acute hepatitis B by giving the vaccination, and we should need to screen the blood and blood products very intensely, religiously. Nowadays nucleic acid assays are available which can detect the hepatitis much far earlier from the blood donors. Otherwise it takes at least 4 to 6 weeks for us to detect the HbA1c in the blood by means of antibodies or antigen detection. But nowadays we have nucleic acids which can detect as early as within a week of onset of infection. So that blood can be discarded and patients can be protected from getting an infected blood with HbA1c positive donor who has donated within a week period of time. So more such awareness should come and we should be able to do that. Now coming back to basic, that we need to vaccinate the individuals. Now there are two subgroups, like we have adults and then pediatric population. As you can see this screen, at the birth only we usually prefer the patient to take hepatitis B immunoglobulin along with the first vaccination. Those whose mothers are actually infected with HbA1c positive within 12 hours of infection, within 12 hours of the delivery. Whereas those people who are like adult, we give usually 20 microgram of intramuscular injection and then we repeat at 0, 1, 6 intervals. So first dose is supposed today, after first month we give another 20 microgram, and after 6 months we give again third dose of hepatitis B viral infection, and it works as a booster dose. Some patients where we don't get effective protection, we come to know by doing antibody titer, anti-HBs, and if they are less than 100, then we say that they are not protected. In that case we repeat the vaccination again same way and see whether they have got response or not. Once they are protected, then they have a 95 to 99% of protection from hepatitis B. For pediatric patient, we give half dose like 10 microgram with the same schedule. Adverse reactions, as you can see that the patients usually have a Guillain-Barré syndrome or multiple myeloma and the flu-like symptoms which are common on day 1 and day 2, but ultimately they respond. Allergic reaction to hepatitis B is also known, but they are very rare. So by and large, I can confidently say that they are very safe vaccination. It can be carried out at home, it can be carried out anywhere. It takes just one prick, one disposable syringe and 2 ml. That 1 ml is what we need, nothing more than that. Now, who should be vaccinated? I think this should be projected in a larger scale, that all infants who are starting with the first dose of hepatitis B vaccination at birth. Now this is included in the immunization program. So by default it is given to every child who in many hospitals where the protocols are 101% followed. Unless they are home delivery and they are not aware, then I think the first line is very important, that immediately after the birth of the child we should be vaccinating the child. Then all children and adolescents younger than 19 years of age who have not been vaccinated should be vaccinated. People who have sexual partners who have hepatitis B should also be protected, provided we check them. Many people come to us and tell that we have taken vaccination, but even they don't know whether they are positive or not. So it's very important, before we take vaccination we check the HbA1c and then only get vaccinated, because otherwise there is a myth that I am vaccinated but actually they are positive. So if you are positive and take vaccine, it is of no use. First you check yourself whether you are protected or not protected. Sexually active persons who are in long-term mutually monogamous relationship, persons seeking evaluation for sexual transmitted diseases. Then people who share needle, syringes and other drug injection, as I told. People who have household contact with someone infected with hepatitis B virus. Healthcare and public safety workers at risk for exposure of blood and blood contaminated bodily fluids and job. People with end-stage renal disease, like they are undergoing hemodialysis, peritoneal dialysis, those patients are all at risk. But only thing is that we give double dose as compared to the non-renal failure patients. Residents and staff of facilities for developmentally disabled patients. People with chronic liver disease because of other disorders. People with HIV infection. Anyone who wishes to be protected from hepatitis B, I hope that after this many people would come forward and get vaccinated. In order to reach individuals at risk for hepatitis B, vaccination is also recommended for anyone in or seeking treatment from following, like STD, HIV, facilities providing drug abuse treatment, and healthcare settings targeting services to injection users. So in short, probably at the end of the session, hepatitis B is actually a better disease as compared to hepatitis C because there is a vaccine available. For hepatitis C, there is no vaccine available. The risk of chronicity in hepatitis C is 75%, in hepatitis B is approximately 20-25%, but it's highly infectious virus. That's the drawback of hepatitis B. It is more easily transmitted than HIV, but better treated than HIV. But people actually usually don't look into this HBsAg because of unawareness, because of lack of health education. We all projected HIV as a bigger disease than HBsAg, but if you look at the statistics, HBsAg actually is a bigger alarming situation problem, and it has a treatment, but if you don't take that, it can have a lot of consequences like cirrhosis of liver, hepatic cell failure, HCC. And the good news at the end of this session is that we have vaccine which are time and tested for years, and they can protect the younger generation to come up. So probably it's very high time for us to give a message, alert message that get protected by getting the vaccination done, and screen your entire family at one go, and those who are negative, they all should be vaccinated by a perfect schedule which has been shown to you. Thank you very much.